here from BJC Health. Thank you so much for all the support you've shown our channel over the years. We're looking forward to continue to bringing you hopefully interesting and inspiring content. So this lifestyle event that you're about to watch is about a topic that I'm really passionate about. So a number of our patients here in Sydney, whether it's due to the medication that they're on, age, or other factors, might ask questions about bone density and whether there's things they can do to manage it. So this workshop that we hosted is talking about the role that exercise can play in helping people manage their bone density. So it's presented by myself and Robin Yin, who's also an exercise physiologist, and I hope you enjoy it.
All right. So as Sarah said, the topic tonight is all about bone mineral density and fall. So I thought I'd just start out by really sort of defining what osteoporosis is, as you've probably heard of this term or even the term osteopenia, which are both really related. So osteoporosis is really a disease of the bone, and it's defined by decreased bone mineral density. So that means the quality of the bones becomes deteriorated. And so the strength of them is weaker than normal. Now, the bones become brittle and fragile, and therefore this increases our risk of fracturing or breaking our bones. Now, the difference between osteopenia and osteoporosis is that osteoporosis is more severe, or osteopenia is less severe than osteoporosis. So we really want to try and avoid getting to osteoporosis if possible. Now, here are some just quick stats I thought I would throw off. So from the Australian Bureau of Statistics in 2018, about 924,000 Australians have had osteoporosis. So that was 3.8% of the population at that time. Now, this is also most common in older women. So 1 in 4 women aged over 75 years will have osteoporosis. And interesting to know that once women menopause, we know that their estrogen levels drop. So this will have an effect on bone density as well. Now, diagnosis of osteoporosis is commonly missed, and it tends to get diagnosed only once a fracture occurs. So generally someone may fall, they might break a bone, and that's when, you know, the tests might be carried out to go, let's have a look and see if someone's got low bone density. Therefore, osteoporosis, unfortunately, is underdiagnosed. Now, we really need to consider some of the factors that are related to reduced bone mineral density, and there actually are quite a few. So, you know, simply it can be, you know, women having a higher likelihood than men. We talked about age, so, you know, over 75, or for women post-menopause. A lot of the clients that we see might have rheumatic disease. The disease itself might put someone at a higher risk of lower bone mineral density, and even the medication that they're on. So we know typically steroids, they can have an effect where, there's a reduction in bone mineral density over time. So it's really important that we are aware of some of these factors. Some of them, you know, we can't change, and we can't do too much from a lifestyle perspective, such as family history and age. But we know that through diet, through activity levels, so that guy in the top corner there, he's not very active, is something that we can change. Smoking is something else as well. So there are definitely different factors, and it's important to know what things you can change and what things you might not be able to. So I thought I would actually kind of get us all involved with a poll. So this slide here is asking you guys what types of exercise you think is actually good to build, bone density. So I'm going to try and pull up a poll here. Let's see if I can figure out how to use this. Testing this for the first time. Okay. So I hope you guys can all see something pop up on your screen. So what types of exercise do you think can preserve or improve bone mineral density? I think you should be able to click more than one answer.
Don't carefully because I kept it lost.
If you have no idea, have a guess. So the different types are Tai Chi. You've got walking, jumping or running or anything that is impactful. You've got swimming or aqua aerobics or anything in the pool with water. And then you've got resistance training, so weight bearing or weight training. Still going. I'll give us 15 more seconds. That's it. Everything's sliding. Pretty good. Couple more answers to go. Most of you guys look like you've responded. 23 out of 28 of you have voted. Couple more seconds. All right, I might end it there. Okay, so I'm not sure if that stays on your guys' screens, but let's have a look. That's actually very interesting. So 92% resistance training. Interesting. Then we've got walking as the second highest answer here. Then we've got jumping and impact, then swimming, and then Tai Chi. Well, let's have a look at the answers. I better close this. Sorry, I'm very new to this poll business. Okay, here we go. So Tai Chi. So based on research, it's actually shown that although Tai Chi is wonderful for balance and for mobility, it's actually not very effective for bone density. And we can go into reasons why in the next few slides. Walking as well, not effective for building bone density, which a lot of people will find very interesting. And I do know that, yeah, GPs might actually prescribe this because it's easy and it is weight bearing, but we'll go into that a little bit more detail. That third picture there is someone skipping, but that was skipping, running, impact. So that one's a yes. And we'll talk about, yeah, again, what impact is and why that's actually quite effective. But I also know that that's not going to be the right type of exercise for everyone, but just know that that is one type that is going to be effective. We've got swimming or aqua aerobics, so anything sort of in the water. And again, that one, unfortunately, as fun as it can be and as wonderful as water exercise is for joints, and if we've got joint pain and because it is low weight bearing, not effective for building bone density. And the last one there, we've got resistance training or weight exercise, and that one's a yes. So as you can see, out of all those 5 options, unfortunately or fortunately, only 2 of those modes of exercise are effective at building bone density. Now let's go and have a look at sort of why and why not for some of these exercise types. Oops. Sorry, jumping around here. Okay, so walking and stair climbing. So basically the simple reason why it's not enough is because although it's weight bearing, it's low impact. And the load on our muscles and our bones is just not sufficient. So when we talk about what a sufficient load needs to be, if we think about, we all generally can walk, and on an everyday basis, our bones and muscles are so used to that loading. They're so used to our normal body weight that it's not enough to have a high enough stimulus to actually have an effect on building bones. So stair climbing as well is something that you may have been recommended. And again, although it is a little bit different to walking, it's still not going to provide enough because of your own body weight. But we can talk about how we can potentially make stair climbing something a bit more effective. Okay, so simply just not enough load with walking. Now, if we go into resistance and impact training. So these were the 2 yeses on the slide. And maybe before I go into this, I didn't have a specific slide, but with aqua and with swimming, just like walking, not enough load. And if anything, we know that swimming and anything in water is actually very low weight bearing, or if anything, it's taking the load off of our joints and off of our bones. So unfortunately, it is probably one of the lowest in terms of effectiveness for any weight bearing. And so we need land-based exercise. And that's where I start to talk here about resistance and impact training, because we do that on land. Now, here we know that the bone, in order for it to really get an effect, must be exposed to this load exceeding that experience from daily living activities. And that's why when we talk about weight bearing, we talk about resistance training. It's resistance training, it's adding extra load in the form of potentially resistance bands or dumbbells or anything that's just a little bit more than what we typically weigh. So we know that resistance training has been frequently prescribed because it is safe. Okay. And we know that it not only improves muscle mass, it improves strength, it improves muscle size. And we know that it also is effective in the elderly and people who are frail. So people who have had a history of fracture, people who have falls, it is still safe to resistance train, obviously within reason. And, once we've assessed that person and given them the right exercise for them. So what does the research say? So I've got a slide here that gives us a bit of guidelines, because I know resistance training can be quite daunting, especially if you've never done it before. And there's so many ways you can research on the internet. How do I resistance train? Maybe you've seen a personal trainer, or you've seen people at the gym, and it can just look like a lot's going on. So there are specific exercise considerations that we as exercise physiologists have to take into consideration when we're planning a program for someone who wants to increase their bone density. And we have to consider, the potential chronic conditions that someone has. Someone might have injuries with, people with osteoarthritis. You might not be able to hop or jump. We talked about impact exercise. So we have to be mindful that every person who's going to start a resistance training program is going to be different, and that recipe is going to be different for everyone. So some of the considerations that we need to take into account here is that when it comes to resistance training, for it to be effective for bone loading, we have to gradually progress the load towards heavy loads. Now, I know that sounds really scary, particularly if we've never lifted weights before, but I really use that word gradually. So starting at a point where it's comfortable and it's safe, and over time, by regularly lifting those loads, your body will adapt and your body will get used to that load to a point where you get stronger, and we can step by step increase that load over time. Now, the research does show that we want to be able to lift to 8 to 10 repetitions. And when we get to sort of that 10 repetition point, it should be tough. So sometimes typically we can start exercising and we're lifting smaller weights, and you might start with 8 reps and 10 reps. And as you get stronger, you can start to do more and more. And that's a really good guide to know when you might be ready to progress things. Another consideration that we have to make is that the frequency has to be at 2 to 3 times a week. So the research has shown some say 2 times, some say 3 times, but it is important to get the dose right, because the difference between once a week, also means that your body gets 6 days of rest where it doesn't get that regular stimulus. But of course, we need to be mindful that, training every single day also might not be, safe and good for our bodies, especially if we are doing lots of other things or we are in pain, and being mindful of how we're going to pull up. So this here says resistance training 2 to 3 times a week, and we'd normally recommend every second day, allowing for some rest. But the research also shows that high impact exercise up to 5 days a week is also effective. Now, what is high impact exercise, or what is impact exercise? The easiest way that I can explain this, and I'm going to put my scientific hat on if we all remember back to primary school science, but Newton's third law. Now, Newton's third law basically tells us that for every movement, there is an equal and opposite reaction, right? So if we were to just jump on the spot, you are applying force to the ground, and that ground has to apply a force back into our bodies. So that can be things like hopping, it can be jumping, skipping, running. So something where you are putting a bit of force into the ground. And as I mentioned before, that might not be right for everybody, but it is shown to be effective for people who are able to do that safely. Okay. And interestingly, it can be as little as 10 jumps a day. Okay. Now, Another thing to be considerate of, and Sarah can probably relate to this as exercise physiologists, there's some clients that we have who are very diligent, and we'll give them a program and they'll be doing that same program for the last 3 years, which is wonderful because it just shows how compliant our clients are and how dedicated they are to keep exercising. However, we also know that our bones adapt to what we call customary loading patterns. So our bones are so smart. Okay, and our bones and our muscles, they get used to doing the same exercises that we do all the time. And typically when Sarah will show us later on when we start demonstrating, there's probably some basic exercises that we always go to because they're so effective. But usually in that same movement pattern, in that same direction, our bodies are just so used to that, it starts to become no longer effective. So I've put there in nice big capital letters, we've got to train in multi-directional and multi-planes, meaning not only doing things forward and back. So like when you climb stairs, we go forward. And when we're walking, we're going forward, but doing things sideways, doing things laterally, rotationally, really working through the multi-planes that our bodies are able to go through. So that's just another way to keep our exercise effective long-term. And then the last consideration there, the research has shown, and this is particularly if we aren't able to reach the loading that we'd like. So as I said in the beginning, really we should be aiming for heavier loads in the long term because that is shown to be more effective than lighter loads. But if we can't reach those heavy loads, maybe due to lack of equipment or we just don't have access to it, or we don't feel ready to go the heavier, then the research shows that dynamic and rapid movement, so doing things with speed and with power. So it could be simply a squat, which we'll show you in a little bit, a squat, but doing that with a little bit more speed and a little bit more power, a bit more explosiveness, is going to put more load onto our muscles and therefore the bones to stress it a little bit more. So basically we do want to stress our muscles and our bones, as scary as that does sound, in order for the stimulus to then cause a change and start to build our bones. So I know that was a big slide. There's a lot of different things to go and take in there. And you're probably like, oh, there's so much that I can do for my bones. And that's the beauty, I suppose, of Sarah and my job as exercise physiologists, is that there is so many options out there. But when we have a client in front of us, it's looking at them and going, okay, what's right for you? And devising a program that is going to be safe and that is going to be suitable and is something that you can fit into your everyday lifestyle, because it's not going to be the same for every person based on their needs.
Beautiful. Okay, you can take a breath, Robin. Very good. Well done, well done. And I can see, I think that slide has definitely got some people thinking and asking some questions. So I think we'll ask a couple of the questions now, if that's okay. And so the first one's from Cheryl. And you might have covered it in how you sort of described this slide, but again, maybe to summarize. So Cheryl's asked, if we can't jump and we're not in a position to do impact exercise, then what can help if walking's not sufficient? So I think there's a gap, isn't there? So walking sort of down here, it's better than the pool, but if you can't do the high impact stuff, what would you suggest for Cheryl or someone like Cheryl who might not feel comfortable jumping?
Yeah. Hi, Cheryl. Wonderful question, Cheryl. And I know you're already doing this. But really it's some of the other options. So resistance training. So using our strength training, adding weights, adding resistance to some of those movements that don't involve hopping and jumping. And we're basically, the next slide we're going to start to demonstrate, but it's doing things where we can utilize our bodies and weight. So that's one way. If you're already doing that, it's then making sure it's varied. Making sure, as I said, it's multi-directional, making sure we can add some speed, add some power. It's not doing the same exercises every day for the next few years, although it will be effective initially. So yeah, those are some ways if we can't do impact and running, and it's okay if you can't do impact and running. Remember, that's just one of the options. But it's usually likely you'll be able to do some form of strength training at some intensity, and the high impact will be a little bit higher intensity or a little bit more advanced, depending on what conditions you have.
Cool.
That answers your question, Cheryl.
Hopefully. I love this question from Barbara, which is, and I'm interested to how you're going to answer this one, Robin. It's like, do we always need to be increasing the weights? So if we have to work towards heavy loads, yeah, how would you answer? That's a really good question.
That is a good question, Barbara. It's a yes and a no. So I think when it comes to strength training, if you are diligent and you are consistent, you are going to get stronger. And I would like to assume that those weights are going to maybe start to feel a little bit easier, and you're going to be able to lift that little bit more. So if we can, we do want to progress you if possible. And of course, if safe and if you're feeling able to. But again, as I said, there's other ways. So it's not only just the weights, it's finding variations. So I'm going to start maybe just talking a bit more about exercise. But if we take a standard squat, for example, we can do that squat laterally. So do a side squat. We do things like a curtsy squat. So we do it with a little bit of rotation. We can do a squat off a step. So there's just different ways to tweak one movement, but even doing it in a little bit of a different direction can actually make it more challenging, where that same weight you were using before might still be as challenging. So yeah, that is one way. It doesn't have to be. And again, we talked about then adding maybe speed to it. So you might be doing that same squat with the same weight, but if we do it a little bit more explosively, do it with a little bit more power, that can be challenging in a different way. So no, we don't have to increase the loads always. And if we're not going to, we've got to find other ways to vary the movement.
I think that was pretty good, Rob. Yeah, I agree. Very good. Okay, we might do just a couple more. So we've got a couple of questions about walking. So Barbara's also asked, what about walking with weights? So that's one. But then Joy's also asked, would walking on different terrains be useful? And does that change the effectiveness of the walk if someone's got osteoporosis? So walking with weights and then walking on different terrain. What's your thoughts on that?
That's a great question. I think from a research perspective, and maybe the next slide might be a little helpful, I can sort of jump to this. This really just shows that reaction force with different types of movements. Now, I know this table might look really complex, and it's okay if you don't understand many of those exercises on there, but this is really just a table that the research went through to see what exercises produced what reaction force. And so I think with walking, if you are going to use weights, you're potentially going to need, I guess, a substantial amount of weight to get a reaction force that is going to be adequate enough. So I don't want to rule that out. I just don't know how much is going to be adequate. And yeah, for how much you will need versus potentially doing another exercise that might just give you more bang for your buck. But yeah, again, I wouldn't rule it out with weights. And sorry, what was the second part of the question?
The second part was different terrains. So let's say someone goes for their walks in the bush, or maybe they start walking on the sand. Again, would you say that has much impact on bone loading? So I think maybe one thing as well that's going to help maybe future questions about exercise as well. We're really trying to talk just about bone loading. We're definitely not saying swimming's not good, walking's not good. They're excellent forms of activity that have lots of benefits, just not great benefits if your main goal is improving your bone density. So I think Robin's table might help her answer this in terms of the different terrain. But Robin, do you have anything in particular to add?
I think with terrain, I suppose generally if you're walking on a softer surface, you're probably not going to get as much reaction force because it'll absorb some of those forces. So sand is softer, grass is softer. I'd like to assume that on concrete, you're probably going to have much more force being, as a reaction. So I personally wouldn't know if, the terrain is going to make a huge difference, but I would say walk on concrete if we're going to. Yeah.
Yeah, good answer. I think I wouldn't think it's significant. So I think it's good to vary the terrains you walk on. That's a general principle, as Robin's already mentioned, about making sure you're not doing the same walk on the same thing, the same direction at the same time. So we do typically encourage people to make sure you've got a few walks to choose from. And if that means one's in the bush and one's on the road, I think that will then mean, you can benefit from walking as best you can. But really, when you look at that table, it's still just not really going to give you bang for buck. And if you are open trying resistance training and some other types of exercise, then we're going to be more keen to get you using your time doing those. So I think I've been nervous about this too, Robin. So Robin was keen that one of us demonstrated some of this stuff. So because not necessarily that table, I hope you don't make me do that whole table, Robin, but maybe just so you understand, like what does it mean, Robin, you can, and this is a good chance. I've trained a few people on this call. If you want to get your revenge on Sarah and make her do something challenging, tonight's the night. So if you want to see something, or if you've heard that something might be good for bone density and you want to see it, or you're not sure, again, please use the chat. But Robin might, are we up to the demos, Robin? Is that where we're at?
You can start.
Okay. Hi there everyone, so that was part 1 of our workshop on exercise and bone density. If you'd like to finish watching the presentation, then please consider joining BJC Connect. You can create an account for free, where part 2 of the presentation is readily available for you to watch. But otherwise, thanks for tuning in. If you want to like or subscribe to our channel, that would be great. But otherwise, hopefully see you soon.